Hi, everyone. Welcome to Orthopod. We're here today to talk about a very serious and evolving issue with a friend and colleague who currently is an orthopedic surgeon, an assistant professor at the Federal University of São Paulo, uh, Vinícius Moraes. Vinny, how are you?
Hi, I'm fine. Thank you, Mo. Thank you for the invitation.
Listen, I wish we were chatting on better circumstances, but we around the world are hearing, Vinny, that Brazil has become a new epicenter designated by the World Health Organization. I wonder if you can share from your perspective what's happening.
Oh, for sure. Thanks, Mo, for the invitation. It's been a pleasure to be with you. We've been friends for such a long
Yeah.
time. And what we see here in Brazil, that we have a big issue regarding to the COVID pandemic, because we believe that our country has some unique uh, uh, characteristics of the population that makes the spread of the disease a little bit more serious than it is in other countries. What we see here, I live in the metropolitan area of São Paulo, and what I see here that when you go to the suburban area, people are just not following the rules. Just they are not following to be at home, to be isolated in their homes, and this is because of basically two major factors. That are people they just don't have money to be at home. They have to go to the streets to get some money to get some money to get food, and most of their homes are small homes. And how can you be isolated like with four and five people in a 30 meters square meters house? So this is something that is not practical for everybody. In downtown, in the most important part of the city, we don't see so much of this problem. People are just following the rules, but this is something that is really critical in the suburban area, and this is where the COVID disease is spreading in a serious way. So I just saw the stats about it these days,
Yes.
and we are just facing like 25,000 of deaths in the country, and 6,000 of them in the state of São Paulo. That's where I live.
So, so Vinny, let me ask you this. From the perspective of how rapidly it's increased. I mean, it just seems that it's been going, but suddenly it's just taken off. Have you felt it that way? Has it been sudden, or has it always been looming? And sort of the citizens of Brazil have known it, and citizens of Sao Paulo have felt things are going in the wrong direction.
You know that São Paulo is so big that
Yeah.
we have different patterns of the disease around the city regions. So what we saw 2 weeks ago, that in the north part of the city, there was a huge increase in the cases, and
Right.
then these were followed by the south part of the city. So it doesn't happen at the same time. We feel that some parts of the city are a little bit worse than the others, but what I feel that you cannot see the disease outbreaking that much at the same
Yeah.
time. We have like different scenarios along the city, and this is something that is really tricky because we just don't see the disease how serious it is.
So there are many people who aren't experiencing this in other countries, right? I mean, they are, Canada, for example, has, for many reasons, just been able to have healthcare capacity that's been able to maintain. We've never seen the quote surge that people talk about. When you are trying to help other countries understand what it feels like to be amidst an evolving crisis where we're hearing, now this may be wrong, but we're hearing that it may almost be too late now in Brazil to stop it, like to slow it down because it's just taken off so much that there's an inevitable possibility that you may end up somewhere in the ballpark of 1 million infections, hundreds of thousands of people really seriously ill, and possibly many more deaths. What does that feel like on the front lines as someone who is in the healthcare side of things?
You know that I besides of the COVID, I have been in the hospital almost every day, so I see what the things are happening there. And what we see that in Brazil we have like a battle with the media,
Yeah.
and people just don't know the truth, you know.
Okay.
Some parts of the population, they are just living as the way that they were, and this is what you said. Maybe we cannot just break the virus contagion from these days.
Yes.
It's too many people that is with the disease, and we just can't test everybody. That will be the key for for being succeeded in this scenario.
Yeah. So now that you're in a situation, what do you think is the way forward? What's likely to happen to you and in your hospital environment? What are you doing at this point? Just try to do everything you can to contain more problems once patients arrive. I think in the community, unfortunately, it's going to continue because it's going to continue to multiply for all the reasons you've said. But in the
Mhm.
hospital level, what's happening? How are you managing it? Are you testing everyone, or do you have enough tests?
Yeah, we know that we had, like in our orthopedic division, we had like a crisis management plan,
Yes.
that we had like three action lines. That was first to protect the staff.
Okay.
Second, how we're going to deal with our educational things that we have to do, like to train the residents, to train the
Yes.
fellows, to train the medical students. And the
Yes.
third, what we're going to do with the practice of orthopedics. So we see that our elective surgeries just dropped for half
Yeah.
of them. So
Yeah.
50% of decrease. And even in
Yes.
the ER, we in trauma surgery, we have a decrease in 70%. Because
Wow.
In São Paulo, we see most of motorcycle accidents, and
Yes.
if people are at home, people are just not getting injured for that.
You were saying, and you opened up that in many of the areas that people like how compliant are people with social distancing or physical distancing or staying at home? I would imagine that in a country as densely populated as Sao Paulo, that or in a city, sorry, as densely populated as Sao Paulo, you would have a hard time keeping people apart. Are people able to stay apart, or is this the reason why you feel, as you mentioned, that things are rapidly progressing?
Yes, I think that the main reason that people just can't be at home.
They can't, right?
They are suffering. They don't have savings. They are suffering
Yeah,
from they
yeah.
need food, and that this is they need to get a job. So this is something that the government, they are failing to maintain people at home because it's just not possible.
And you mentioned something about the media and the government, or something's happening. So like we're hearing all kinds of stories, Vinny, from our side, right? And the challenge right now is because we're part of an information epidemic, nobody knows who to trust anymore. So when you hear something, who do you trust? And so from your perspective, what's happening? What is the disconnect? Is it policies that just aren't being enforced? Is it media saying it's fine, be outside, or is it the opposite? What's happening?
I think that we have a president that is liberal, that wants
Yes.
the economy to run instead of
Okay.
the disease.
Okay.
He's not caring about the number of deaths. He just wants the economy to run.
Okay.
In the other side, we have the media that is very worried about the number of deaths and
Yeah.
about the advices of the World Health Organization. So we
Okay.
have a battle between the president and
Okay.
the media, and the person who is in charge of about the taking care of the disease is not the president, are the governors. So the
Okay.
governors are the one that runs the health system.
Yes.
So we have the president in one side, the media in the other side, and the governors making like a political game among
Yeah.
the
In the middle.
president.
Yeah.
And this is the
Very, very,
challenge.
very, very difficult. And I mean, I guess from that perspective, when you talk to patients, is there now just a fear to come to the hospital? Is like, for example, how many COVID patients are in the hospital environment for you? Is because we've seen that once a center gets COVID cases, both healthcare providers get COVID or patients get it. Patients then say, I'll stay away, which creates even more problems because now they stay sick at home and they die at home because they're not getting treatment. Is that starting to happen, or is that a risk?
Yes, yeah, this happened so much in São Paulo. I'm gonna tell you a case.
Okay, sure.
The first hospital that diagnosed COVID,
Yeah.
one of the biggest private hospital of the country,
Okay.
and they made like something like a propaganda, an agenda regarding to care about COVID,
Yeah.
and this lead to a collateral effect that nobody wants to go to this hospital because it
Yeah.
feels like this is the place where COVID
Yeah.
was first handled.
Yes.
So the hospitals are facing this problem. As you can see in my hospital, we were 4 orthopedic surgeons in the ER each
Yeah.
day. We are with one, and the other one is working by telemedicine.
Wow. Okay.
So
Okay.
so our jobs are being in risk because of the disease. Nobody wants to go to the hospital. The hospital can pay everybody.
Yes.
So most of the time we are at home working partially.
Wow. And what do you think will be the impact just from the healthcare? I mean, is there a from the orthopedic surgeon community, how are they managing? Like how are you and your colleagues managing with this? I mean, are you generally united in one approach, or is there also differences among the way orthopedic surgeons are viewing COVID?
What we are seeing here strongly in Brazil is one mentality that maybe the orthopods are not necessarily all the time in the trauma center. And
Yeah.
this is
Right.
something that makes us really upset because we see that in most of the hospitals they are trying to put like more general physicians and use the orthopedic surgeon by telemedicine,
Right.
teleconference, and this will decrease our workforce in the medium and the long term.
Oh yeah,
In the
yeah, yeah,
future.
yeah, for sure. So since Thursday or over the weekend, what's happening like in terms of daily right now? What is the current situation? Are things just every day getting worse and worse and escalating up? Are you into almost an emergency protocol at this point, or is it still far from that? It
We are
seems from our
having
perspective, it's pretty serious.
for sure. We are having like 1,000 cases a day, and it doesn't seem that our curve are flattening. It's
Yes,
increasing. Uh,
yes.
what I have listened that we are gonna have like 2,000 cases in 2 weeks, and I
Oh
believe
wow.
that yes, and I believe in for the next week the governor will have to choose whether he's going to lock down the city. That will be
Can you I mean, Vinny, can you lock down Sao Paulo? Can it be done? I mean, how would you do that when so many, I mean, and when we even think about whether, let's say India did a lockdown, right? They did what others to say, we just locked down the country with 1 billion people. The truth is there's so many of those billion people who live in very, very tight villages that they are basically a small community, arm in arm, touching each other all the time, millions of them. So it's very difficult.
maybe it will not work, but I think that the governor will try to lock that down the city.
Yeah.
I think for the next week.
And
Don't know
so
if
that
it's going
means,
to work.
yeah. No, 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 no. I mean, at this point, you do everything. And, have you been, we've been hearing also that, all kinds of treatments that we know don't work are being promoted around the world.
Uh-huh.
We've seen around the world anti-malarials by some groups saying everyone should get anti-malarials. But the problem is they actually cause a lot of harm too. The evidence
Yes.
is not absolute. Have you been seeing all kinds of messaging to try anything? Just give people all kinds of treatments that you of all people I know is very evidence based. But I'm curious what sort of approaches are being used.
You know that the protocols from the hospitals are very different one from the other. But what I
Yes.
see here that we are using these drugs as a passionate way. If you don't have nothing to give to the patients, people are just giving like hydroxychloroquine
Yes.
and
Yes.
also
Right.
enoxaparin.
Yes.
Most of the patients that are getting the severe disease that are going to the ICU and need a ventilator. So, but we have like a battle with the president. The president misleads people saying that chloroquine it's is very good and should be used from home.
Mhm.
And this is something very, very, very difficult. The Minister of Health asked to leave the role because of chloroquine.
No, it's a very difficult time, and you can imagine all kinds of stressors are happening. And the truth is, we don't know what to do when there's all this. A crisis is always the biggest thing in a crisis is you need to get good information, and then you have to use it, right? You have to use it. You know, we always say evidence doesn't cease to exist because we ignore it. We have to figure out what works and what doesn't. Let me just ask you in closing, Vinny. I mean, you know, you have seen what's happened so quickly. I mean, you know, and just imagine both of us 3, 4, 5 months ago, imagining what 2020 will look like. It's very different for us.
For
As you
sure.
look into the next 6 months, what do you envision? Like, what do you see happening at this point? How is life for you going to be different after all of this?
Um, it's a very tough question,
It
very
is.
difficult question. But I think that from the Brazilian community that we're gonna have a way, we're gonna see the world, the world differently. Everything is
Yeah.
going to be different from them. It's not going to be the same. I think that the things that we love, like going to a soccer stadium or seeing a concert, it's going to be not as the same. And from the economic perspective here in Brazil, I think that we're gonna have to spend like 2 or 3 years to make our economy run again. We were such in a good scenario, and now we are just slowing down as the world is slowing too. We feel that
Yeah.
some
No, go please.
we feel that we may need like some help from the world, like it happened in the history previously, like money issues and
Yeah.
things to get our economy running again. And this is what we expect to happen. I don't know if it's going to happen, but that's the way that I think.
And you know, I mean, I do think the same way you do. I've had a lot of time, and I'm sure you have too, where we're at home and you're reflecting on what to do and you're trying to be as productive as you can, but you're realizing everything's different now and you don't know if it's going to come back to the way it used to be. And we don't know when it's going to come back to the way it used to be. And that's the whole other area of uncertainty. You know, in other parts of the world, people are talking about, well, possibly reopening. You can't even imagine what's going through your mind when you're about to head into a crisis. Reopening is the last thing on your mind. Right now, it's about saving people, finding a way to come together, and then in the future saying, how do we all learn from this and how does the world learn from this? But I would put it this way. This is probably the first time in a long time, at least in my lifetime, that everybody in the world, whether you're from a rich country or poor country, whether you're the rich or whether you're the poor, we are all feeling something very similar to different
Yes.
degrees, obviously, and there's very different privilege. But I think it's the first time where we have a chance to think, as my last speaker, and we were chatting from a surgeon from Pakistan said, we are finally a global family and we have to look out for each other. And I think this sort of interaction with you is really important because you're able to share what's happening in Brazil as a trusted member of the orthopedic community and someone that we obviously have great respect for and great pride in the work you're doing. So for me, it's been a great pleasure to have you and to connect. I wish we have an opportunity to see each other, and I'm very optimistic. We'll have you back up to McMaster, or I will come visit you and you bring the family. That'll be wonderful.
Thank you.